and we're delighted to share with you some information about what students and families might expect as we all navigate together the back to school challenges and the diverse ways in which our children are going to be asked to learn, depending on what their families have decided or their school districts have decided, or a combination of the two. So if you're a patron, we're delighted that you're joining us. We absolutely must thank Jonathan Pryor for his leadership at his library at Sayville Public Library. Thank you so much for inviting us and hosting this program and making this a priority topic to bring to your patrons. And I also want to thank all of the faculty and the students from Stony Brook Medicine, from nursing, from public health, from health science, and so from social welfare, who have all contributed to put the material together that Jonathan felt would be important for patrons to hear. We lastly just want to thank any other libraries that are involved in sharing this material. We have a wonderful partnership with the Suffolk Cooperative Library System, which we learn from every day, but helps us when we have material like this prepared to be sure that we are reaching out effectively to our partners at the public library. So thank you for giving us this hour or so of your time. There will be a chance for you to ask questions. You can do that using the chat function, which is at the bottom of your screen. And there's lots of Stony Brook people who are monitoring the chat. In addition to our students, we do have an expert speaker tonight, and each of the experts will be introduced to you, as well as our outstanding student presenters. And we will answer either in the chat actively with the others involved while the speakers are speaking, or at the end, we also would love to have a conversation and answer some of your questions.
Thank you, Dr. Ben-Scott. Okay, next slide, please. So welcome, everyone. I would like to talk a little bit about the Stony Brook Medicine's Healthy Libraries program, also known as the HeLP program. This program is a partnership with the Public Libraries of Suffolk County, the Suffolk Cooperative Library System Outreach Services Department, and it is supported in part by the American Heart Association of Long Island. This program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. Another aim is to refer patrons to promote access to appropriate health and social service programs locally that will address their health and social support. And lastly, for students to experience an interprofessional team and demonstrate the core competencies based on the interprofessional educational collaborative. Next slide, please. I would like to acknowledge our student leaders. They will introduce themselves in a moment, but we have Gwen Mersep, Philip Massaro, Winnie De Los Santos, and Christine Weber. We thank you for preparing this presentation for us. And I also would like to introduce you, Dr. Lisa Ben-Scott just spoke to us, thank you. She is the professor and director of the program in public health. I am Mary Ellen LaSala, and I'm the chair of the Department of Undergraduate Studies, School of Nursing. We also have Leah Topek Walker. She's a licensed social worker, field educational coordinator, School of Social Welfare. Jessica Kuz, she's our health science librarian, School of Medicine, Program in Public Health, and Biomedical Informatics. And Gabriella Pandafelli is the graduate student, Master of Public Health, and she will be joining us in a few minutes. So as you can see, this is an interdisciplinary team that works together to help provide this health program to the different libraries. Next. Good, thank you. So Philip is going to assist us to complete this pre-webinar poll. Philip?
Hello, everyone, and good evening. So we just have a few short questions. If you guys could fill this out for us. I'm going to be launching the poll. It's in Zoom. You should see it pop up on your screen. All right, so we'll give everyone just a few minutes to get that completed if you don't mind. Again, just a few short, simple questions. We're not keeping anyone's personal information. We're not looking at individual scores. This is just a general survey for us to keep track of certain items as we move forward in the presentation.
Okay, Philip, will you tell us when everyone has submitted?
All right, it looks like most of you guys have completed the poll, so I appreciate that.
Yeah.
We will finish the poll and we'll go ahead and get started with this great presentation.
Okay. And now it is my honor to introduce our expert for this presentation, Dr. Maria Milazzo. She's the director of the Primary Care Pediatric Nurse Practitioner Program at Stony Brook University School of Nursing. She's a nurse practitioner and she loves to work with children and families at the RBK Pediatrics in Comac, New York. And this is just a snippet of Dr. Milazzo's accomplishments. So welcome and thank you so much for sharing your expertise with us this evening. Okay, next slide. Okay, so I'd like to begin introducing our wonderful students. Gwyneth Mersep, would you like to begin and tell us a little bit about yourself?
Hi, everyone. Thank you for joining. My name is Gwyneth Mersep. I'm a junior studying health science at Stony Brook University. I have a professional interest in epidemiology. I'm a research writer for the Scientific Review on campus and an intern currently at the New York City Department of Health. And I'm going to pass it over to Philip.
Hello, everyone. Good evening. My name is Philip Massaro. I'm a senior nursing student at Stony Brook University School of Nursing, working to become a registered nurse. I'm also certified as a health education specialist, a CPR instructor, a New York State firefighter, and a critical care EMT. I'm looking forward to sharing some great information with everyone tonight. And I'll pass it off to my other colleague, Winnie De Los Santos.
Hi, everybody. My name is Winnie. I'm a second-year undergraduate student at Stony Brook, and I'm just excited to be working here with you guys and presenting this wonderful information. And now to Christine.
Hi, my name is Christine Weber. I'm a first-year graduate student at the School of Social Welfare at Stony Brook University. My interests include support services for the elderly and helping those with cognitive disabilities.
Great, thank you, Christine. Next slide, please. Dr. Milazzo.
Hi, okay, so I'm just going to go over the learning objectives for this evening's program. And so what we're hoping to do is, by the time we finish this presentation, be able to identify how old the child should be to wear a face mask and when they should wear the mask, be able to identify the temperature for a child where they should stay home from school, identify steps for creating a proper sleep schedule, identify risk for child to get COVID-19, and be able to talk about correct method for hand washing and hygiene practices. And identify methods to ensure quality screen time for kids and teens, to identify healthy snacks for children, and identify types of food groups that we should think about when we meal planning, and identify the duration of physical activity that's recommended for children, as well as the warning signs of depression in children.
Thank you, Dr. Milazzo. So can everyone put themselves on mute at this time? If you would like to ask a question, please enter the question into the chat box, and we will work on answering this throughout the presentation. And at the end of the presentation, we'll have a question and answer session, and Dr. Milazzo will help us answer those questions. So now I would like to introduce Philip again. Thank you, Philip.
You're welcome. All right, good evening, everyone. So tonight we're talking about going back to school, a lot of concerns for parents, including their children, and with children heading back to school. So we're going to get started. So heading back to school and COVID-19. So the coronavirus pandemic has really changed our lives, and we must now rethink how we do certain things. In March 2020, certain schools throughout Suffolk County were sent home and moved to a virtual format. School districts have been working and have developed a plan for reopening that's committed to the following: providing for health and safety of students and staff, providing for social and emotional support, the diverse academic needs of all students during the pandemic, providing support services to all students, and opening communication among all community members. So what is COVID-19 and what are the symptoms? COVID-19 is caused by infection with a new coronavirus called SARS-CoV-2. In COVID-19, the CO stands for corona, the VI stands for virus, and D stands for disease. The 19 refers to the year that the coronavirus was identified. The virus that causes COVID-19 is thought to mainly spread from person to person through respiratory droplets or particles produced when an infected person coughs, sneezes, or talks. People with COVID-19 have had a very wide range of symptoms, reporting from many mild symptoms to severe illness. Some symptoms may appear between 2 and 14 days after exposure to the virus. So if you don't feel well, make sure you stay home when you're sick. Some symptoms include a cough, shortness of breath or problems breathing, chills, sore throat, loss of taste or smell, muscle pain, fever, runny nose, diarrhea, feeling nauseous, vomiting, feeling tired, having a headache, and even a poor appetite. With COVID-19 in children, most reported SARS-CoV-2 COVID-19 infections in children aged less than 18 years old were asymptomatic or very mild symptoms. The rate of COVID-19 associated hospitalizations among children was 8 per 100,000 people, and which is very low compared to adults, which is 164.5 per 100,000 people. 42% of children who were hospitalized had one or more underlying medical condition, including obesity and chronic lung disease. In the United States, of the almost 4 million cases in which had an outcome, about 3.8 million, or 95%, recovered or discharged from the hospital, and 193,000, or 5%, resulted in death. Out of the 170,000 total deaths involving COVID-19, only 60 of those were children less than 1 to 15 years old, with the data coming from February 1st through now September 2nd. Some of you may have heard of this. It's called multisystem inflammatory syndrome in children, or MISC-C. It's a rare but serious complication associated with COVID-19. It's a condition where different body parts can be inflamed, including your heart, lungs, kidneys, brain, skin, eyes, or your gastrointestinal organs. Children with multisystem inflammatory syndrome may have a fever and various symptoms, including abdominal pain, vomiting, diarrhea, neck pain, a rash, bloodshot eyes, or feeling extremely tired. The cause of multisystem inflammatory syndrome in children, unfortunately, is unknown. Many children with multisystem inflammatory syndrome have the virus that causes COVID-19 or had been around someone with COVID-19. So is your child at risk? Children appear to be at a lower risk for contracting COVID-19 compared to adults. While some children have been sick with COVID-19, adults make up nearly 95% of reported COVID-19 cases. Early reports suggest children are less likely to get COVID-19 than adults, and when they do get COVID-19, they generally have a less serious illness. As of July 21st, 2020, 6.6% reported COVID-19 cases and less than 0.1% of COVID-19 related deaths were among children and adolescents less than 18 years of age in the United States. For more information and more details on the statistics of COVID-19, be sure to visit the CDC's website linked here. So we're going to talk about COVID-19 and primary prevention. What can we all do to stop the spread of germs? First, we'll talk about hand washing. So parents and teachers play an important role in teaching children to wash their hands. Parents and teachers should be sure to lead by example. Frequent reminders should be given to wash hands with soap and water for at least 20 seconds, especially when doing the following: before eating or preparing food, before touching your face, using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, and after handling your mask. If soap and water are not readily available, or you don't have those at your availability at that time, make sure you use a hand sanitizer that contains at least 60% alcohol. Make sure you cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Should you wear a cloth face mask or face covering? Yes. The Centers for Disease Control and Prevention, the CDC, has great information for those who want to learn more directly on their website. Are face masks effective? The answer is yes. In community settings, cloth masks may be used to prevent community spread of infections by sick or even asymptomatic infected persons. A multi-layer cloth mask designed to fit around your face and made of water-resistant fabric with a high number of threads and fine weave may provide reasonable protection when it's used correctly. The image on this slide shows how masks reduce airborne transmissions. The infectious particles, or the small particles in the air that cause this disease, can be transmitted or released when you're breathing, speaking, coughing, sneezing, by an asymptomatic or symptomatic person as well. Having no mask maximizes exposure to the disease, whereas universal mask making results in a least exposure. School-aged children will be required to wear a mask at school unless they're exempt. Adults should lead by example and wear masks properly. We want to make sure that the mask fits snugly but comfortable against the side of the face, completely cover the nose, mouth, and chin, are secured with ties or ear loops, include multiple layers of fabric, at least 2, allow for breathing without restriction, make sure that they can be washed and machine dried, make sure that we label your child's mask clearly with a permanent marker, consider providing your child with a container to bring to school to store their masks, practice with your child putting on and off a mask without touching the cloth, and explain the importance of wearing a mask and model wearing masks, especially in situations where physical distancing is difficult. So if you have a young child, we want to make sure that we lead by example and wear a mask. We want to make sure that we praise our child for wearing a mask correctly. Put a mask on stuffed animals, draw a mask on a favorite book character, show images of other children wearing masks, or even allow your child to choose their mask that meets any dress requirements your school may have. And to prevent bullying, we want to make sure that we talk to our children about how other people may not be able to wear masks for various medical reasons. We also want to consider taking steps, see what steps your school will be taking to minimize the potential for students to be singled out or teased for not wearing a mask. Appropriate and consistent use of masks will be challenging for some children, and we absolutely understand that. Who should be wearing a mask? New York State law requires that all people 2 years of age and older wear a mask while in public settings and when social distancing cannot be done. So wearing a mask with a history of asthma and cystic fibrosis can be very difficult, and wearing masks in public is standard. However, please contact your healthcare provider if you have questions about wearing your mask. People who are deaf or hard of hearing, consider using a clear mask, a mask with a clear portion of it so we can read those lips. If a clear mask is not available, make sure we can use written communication or even closed captioning. Now, many people talk about wearing a mask versus a face shield. The CDC, the Center for Disease Control, does not recommend using a face shield as a substitute for masks. Primary prevention. We talk about social distancing. Social distancing, also called physical distancing, means keeping a safe space between yourself and other people who are not from your household. Social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home. Expect your child's school routine activities to be limited or redesigned to make school distancing possible. Talk about well visits and vaccinations. It's important to remember that regular visits with your pediatrician are vital to your child's health. Missing a regularly scheduled pediatrician visit could limit the doctor's ability to catch developmental, social, or emotional conditions early on. Vaccines are also important to protect your child from serious illness. According to Dr. Kevin Slevin, a pediatric infectious disease specialist in New Jersey, COVID-19 is not the only infection risk for children. In fact, infections like whooping cough or the measles are potentially even more life-threatening to children, which again is extremely important to remember to take your child to these well visits to their pediatrician and their healthcare provider. So talk about COVID-19 and school reopening. What we've all been talking about, how are we going to return to school safely? So what did your school district decide on? Did they decide on a hybrid model, a remote learning model, or even a fully in-person model? A hybrid model is a combination of in-person learning and remote learning. For some, there are 2 cohorts of students. Some students on Monday, Tuesday, were in cohort 1, attend school. And on Thursday, Friday, in person for cohort 2. And Wednesday is a remote learning day for all students where the school is able to thoroughly decontaminate and clean that building. And remote learning days will have virtual activities and also live teaching sessions when available. Some schools having strictly remote learning, just like any other school day, students will have a schedule to keep and will start their day together online. Although they will not be in a physical classroom, they might meeting using Zoom, like we are here, or even Google and other platforms. To see your school district's reopening plan, head to newsday.com, where they have a list of full reopening plans for each district in Suffolk County. So returning to school safety, we'll talk about transportation. So using transportation to and from school, we want to make sure that we practice hand hygiene before you leave and once you return to school. Wash your hands. Make sure that we avoid touching your eyes, nose, and mouth. Practice social distancing. Wear an appropriate face covering. Stay home when appropriate. Have plenty of supplies. And if you're carpooling with other children, plan on every child in the carpool and the driver to keep wearing a face covering for the entire trip. Great picture here from the National Council on School Facilities. How many students can ride the bus? Most school districts haven't developed a plan where they have set specific seating areas for children to minimize and really maximize anyone from getting sick or further spreading infection. So some safe practices in school. We'll talk about the lunchroom. Lunchroom can be a very tricky situation, but most children each school district will create its own rules for lunch. Make sure that we check your local school district guidelines for any more specific information. Lunch will be monitored by teachers, sometimes offering or grab and go lunches where the students will get lunches and then come back to the classroom and eat. Hand hygiene before and after eating. Sit facing the same direction. And for students in hybrid models, meals on the days of remote learning may still be available for your children, which you can pick up in advance. Please check with your local school district for specific instructions. So athletics and physical education. Athletics and physical education and music and arts will be very different this semester and the following school year. So in the fall 2020, the sports start date for New York State has been moved to September 21st, 2020 to give schools optimal time to get a plan in place and to devise a plan of action. Rules on athletics may vary by school district. Be sure to check with your school district. Make sure that students are performing lower risk activities that have less physical contact, such as soccer, tennis, and follow primary prevention by social distancing, wearing personal protective equipment, proper cleaning and disinfecting of equipment. And music and arts, again, is also going to be different. During chorus and music practice, students must stand 12 feet apart from each other, again, to keep that social distancing. At this time, I'm going to hand it over to my coworker, Gwyneth, who will talk about a few more things.
Hi, everyone. Okay, so we're going to transition into back to school checklist for parents. So a checklist for planning in-person classes. So check in with your child each morning for signs of illness and have a working thermometer. If your child has a temperature of 100.4 degrees or higher, they should not go to school. Make sure your child does not have a sore throat or other signs of illness like cough, diarrhea, a severe headache, vomiting, body aches, or loss of taste and smell. If your child has had close contact with someone who has COVID-19, which is closer than 6 feet for 15 minutes or longer, they should not go to school. Identify your school point persons to contact if your child gets sick. And this image right here just shows screening checkpoints that could exist at home, via transportation, and at school. So make sure student information is up to date and emergency contacts, and make sure emergency contacts and individuals that are authorized to pick up students from school are all checked out. Make sure not to include anyone who is at increased risk for severe illness from COVID-19, and make sure your child is up to date with all recommended vaccines, especially flu. Develop daily routines for transportation and things to pack for school, like hand sanitizer and additional mask, and things to do when you return home, like washing your hands and washing worn masks. Reinforce the importance of physical distancing and avoiding shared objects with other students, including water bottles, writing instruments, and books. If your child receives speech or other therapy services, ask your school how the services will continue, and make sure to label your child's face covering clearly so they don't get confused with other masks. So a little bit on children with medical conditions. So parenting children with special needs, it's important to rely on past experiences before COVID-19. So keep a consistent schedule for meals, medication, bedtime. Schedule quiet time to reduce sensory input, promptly correcting and redirecting negative behavior, and offering a chance for a redo. Manage stress by staying healthy with exercise and fostering good sleep hygiene. Help your child feel in control during these unprecedented times. So this can help help to disinfect high traffic areas within the home, such as doorknobs and light switches, waving or giving smiles instead of hugs or fist pumps. Revisit your child's treatment plan / care needs. So identify an alternative caregiver in case regular caregiver comes down with COVID-19. Speak with your healthcare provider about office procedures such as telemedicine, and stock up on at least 1 month's supply of medication and medical supplies. So in terms of vulnerable children, children with compromised immune systems, and underlying medical conditions. Children who have medical complexity, who have neurological, genetic, metabolic conditions, or have congenital heart disease might be at increased risk for severe illness from COVID-19 compared to other children. So make sure to, again, encourage social distancing, wear a mask, wash hands often, limit contact with commonly touched surfaces or shared items. And if your child has an underlying medical condition, you should continue to follow your treatment plan, continue your medications, have at least a 30-day supply, and do not delay getting care for your underlying medical condition, and call your healthcare provider if you have any concerns. You can view the CDC Back to School decision-making tool at this link for further information. So a little bit on screen time and sleep. So to ensure quality screen time, review programs, games, and apps before allowing your child to view or play with them. Interactive options that engage your child rather than those that just require pushing and swiping and staring at a screen are better. Use parental controls to block or filter internet content. And setting limits for older children. So it's important to create tech-free zones or times, such as during mealtime. Discourage use of media entertainment during homework, no exposure to devices or screens, 1 hour before bedtime at least. Consider using apps to control the length of time a child can use a device, and require children to charge their devices outside the bedroom at night. And don't let screen time affect sleep, schoolwork, and other behaviors. So on sleep, sleep is important because sleep empowers an effective immune system, sleep heightens brain functions, sleep enhances mood, and sleep improves mental health. So schedule and routine. It's important to wake up at a certain time, to set your alarm and have a fixed time to get up every day. And wind down time, take time to relax and get ready for bed. And bedtime in general, make sure to pick a consistent time to turn the lights off and fall asleep. A little bit more on sleep. So sleep guidelines during the COVID-19 pandemic. Reserve your bed for sleeping, even though it might be tempting to sit there and do classes. See the light, spend some time outside in natural light. Be careful with naps. Stay active, practice kindness and foster connection. Utilize relaxation techniques. Watch what you eat and drink, and stop using devices such as TV, phone, an hour before bed. And contact your doctor if you have any additional questions. Okay, so now on nutrition and eating. What should your children be eating? We're going to cover meal plan, eating on a budget, healthy eating, snack options, and exercise. Okay, so meal planning. It's if you're interested in meal planning, it's important to make a menu, either weekly or monthly. Use seasonal foods, incorporate whole grain fruits and vegetables into the menu. Stock pantry with all different food groups, non-perishable as well. So purchase frozen vegetables, beans and legumes, frozen fruit or fruit cans and juice, and keep a running grocery list. Only purchase what is needed and stick to the list. And use an app specifically for writing lists and staying organized. This includes apps like Out of Milk or Ideal Master. And tips and tricks for prepping a meal on a budget. So plan around sales, check flyers and coupons. For the produce section, purchase seasonal and local fruits and vegetables, which may be more affordable. Frozen or canned alternatives. Grains and dried goods. Stock up on high fiber and non-perishable foods such as beans, legumes, and whole grains. And at the meat counter, consider purchasing larger quantities and freezing excess for future meals. Reduce waste, cook once, and use twice. So the cook once, use twice principle is weekly meal preparation on Sunday can save time during the week. So easily heat it and eat it throughout the week. Leftovers from dinner can be made into lunch for the next day. Examples include dinner being grilled chicken, sweet potatoes, and broccoli, and lunch being a chicken salad wrap. Or another dinner option could be black bean tacos with colorful bell peppers, and for lunch, using the leftovers to create a taco salad or enchiladas. And another dinner idea could be meatballs, brown rice, and a variety of vegetables. And for lunch, using the leftovers, create a meatball sandwich with leftover vegetables. So healthy lunches to pack or eat at home. Purchase a lunchbox with compartments to give children a variety of food. Lunch ideas include a sun butter sandwich with applesauce and a cheese stick, a turkey sandwich, baby carrots, and a green apple, turkey roll-ups, cheese, crackers, grapes, and almonds, hummus, pita, 3-bean salad, cherry tomatoes, and watermelon, and hard-boiled eggs, sliced peppers, cucumbers, pretzels, and banana are all great lunch options. So healthy snacks. It's important to eat fruits, that look like the rainbow. So apples, bananas, oranges, and grapes, non-fat yogurt or Greek yogurt, nuts and trail mixes without the M&Ms and all the candy, popcorn, nut butters eaten with celery, hummus with carrots, granola bars, and make sure to look out for added sugars and artificial ingredients. Okay, so now we're going to transition to physical activity. So physical activity for children aged 3 to 5. Children aged 3 to 5 need to be physically active. Play should be encouraged throughout the day. This will aid in growth and development. A simple game of tag will get a child running around. Encourage running and jumping activities when engaged in play. And playground activities invigorate a child. So physical activity in children and adolescents. Children and adolescents aged 6 to 17 should participate in 1 hour or more of physical activity each day. A combination of activities will give a child a balanced exercise plan. Rigorous running and aerobic activities are intended to raise the heartbeat. Running and jumping are known to strengthen bones. Climbing and push-ups help to build muscle. Examples of activities are soccer is a great aerobic and bone strengthening activity. Families and friends can bike together to encourage children to participate in aerobic exercise. Wear a helmet when riding a bike, don't forget. A dance party is always fun and a great form of exercise, and playground activities such as jungle gyms. Okay, so this is recommended resources for physical activity. The Center for Disease Control has free information on exercise, Department of Health and Human Services, New York State Department of Health. Check with your local community outreach and township for programs, Long Island Health Collaborative, and check with your local library programs and resources. Thank you. Okay, now I'm going to pass it over to Winnie, who is a social work intern. Thank you.
Hi guys, I'm just going to speak to you guys about mental health and children with COVID. So next slide. So to talk to children about COVID-19, you have to remain calm and give reassurance, make yourself available to listen and to talk, avoid language that might blame others, pay attention to what children see or hear, provide information that is truthful and appropriate, teach children everyday actions, and discuss new actions that are taken at school to help protect children. So some of the warning signs of anxiety may be constant reassuring, like asking if you're going to be okay, if like your family member is going to be okay, separation anxiety, and then there could be physical symptoms such as headaches or stomach aches, moodiness, irritability, tantrums or meltdowns, or sleeping. And some of these symptoms may also be a result of like social isolation because of COVID-19. Next slide. So to help young children cope with anxiety, you have to check in with them. Don't ask them vague questions like, how was your day? Be more specific, like, how did you feel when we did this or that? You also have to structure their day with chores, schoolwork, exercise, and socialization. You also have to avoid giving too much reassurance because you may not always be with your child, and giving too much reassurance may be a cause to heighten their anxiety at certain points. And you also have to incorporate activities that promote mindfulness. highlight the positives, and then lead by example. So wash your hands often too, wear your mask, practice social distancing. Depression in young children may manifest itself in many ways. So that's with unusual and persistent irritability, loss of interest in activities they once enjoyed, changes in weight, and changes in sleeping patterns. Again, this may also be as a result of the situation we're in right now, because you can't be doing the same activities or hanging out with your friends the way you used to before. So also, depression may manifest itself with a harsh self-assessment, like I'm ugly, I'm dumb, I'll never make friends, by feeling worthless or hopeless, or thoughts or attempts at suicide. So again, checking with your kids by fostering a positive and accepting home environment, encourage them to talk about their feelings, help them stay active, challenge their negative thoughts, and help them put their concerns into perspective. So let them know that you are doing your best by wearing your mask, washing your hands, and keeping a safe social distance. Next slide. To manage depression, make sure you create a routine. Don't let kids get stuck in a rut, because that's just going to exacerbate symptoms. So as Gwyneth was saying, make sure to incorporate healthy meals, also set goals and make plans with their friends. Social distance or virtual meetings are good. Also focus on gratitude, and if symptoms persist, make sure to seek treatment from mental health professionals. Something to help your children manage their emotion, you can create a feelings chart, which can help them point out how they feel, because sometimes kids may have trouble explaining how they feel and putting their feelings into words. So feelings charts may be of help to do that. Another thing that could be useful is a calm corner, which can help children decompress whenever they're feeling overwhelmed. So it's kind of like a non-traditional time out, which can include books, puzzles, and like drawing and writing materials, so they can just calm down and relax, and then you guys could talk about how they're feeling and their emotions. And you could also leave the stressful environment and go for a walk if you need to, get some fresh air and stuff. All right, now to Christine.
Thank you, Winnie. Hello again, I'm Christine. I'm also a social work intern. So today I'm going to talk to you about the mental health of teens. And the uncertainty of COVID-19 in the new school year has parents and children alike stressed out, but young adults especially can have a tougher time coping emotionally. Feelings of anger, depression, anxiousness, and hopelessness can be warning signs that your teen needs more support during the coronavirus pandemic. Next slide, please. So, what can parents do to help protect their teens before social isolation sets in? Well, first off, you can explain that anxiety is a very normal emotion and that everyone experiences it in one degree or another, especially during a pandemic. Encourage them to ease their minds by having family game night, watch a movie together, or put together a 500-piece family puzzle like me and my family have done. Help them find new ways to connect with friends while social distancing. This is very difficult for adults and children, especially teens. But you can do things such as a virtual scavenger hunt, or go on FaceTime, have an outdoor movie night when the weather is nice. And have them focus on themselves by learning a new skill, such as cooking, teaching themselves how to play a musical instrument, or taking a virtual art program. I know many of the local libraries offer these services, especially the Sable Library. Help them learn gratitude for what they do have and what they are thankful for. Also, encourage them to notice that some good things have come out of this unprecedented time, such as family bonding and having meals together. So some possible red flags that your teen may need additional support if they're struggling to cope with COVID-19. This would be sleep disturbances, such as sleeping too little or not being able to fall asleep or stay asleep. weight changes with eating too much or not having an appetite and losing weight, reckless behavior, which also includes drugs and alcohol, problems with concentration and memory, uninterested in their appearances and cleanliness, like their tidiness of their room. They may have changes in their mood that are atypical for your child, such as irritability, arguing with friends all of a sudden, or feeling hopeless. Changes in behavior, such as going from an independent teen to one who becomes clingier, or one who was once outgoing and fun has now become withdrawn or more of a homebody. Suicidal ideation or talks about suicide. Any talks about suicide should always be taken seriously. Reach out to your child's healthcare provider. So next we'll talk about some tips with parents and schooling, homeschooling. Let's be realistic and consistent in the expectations. For instance, young children have an attention span of only like 10 to 15 minutes. So it's important to set regular daily schedules, try to mimic your child's schedule as his or her schedule would be in school. Find activities that encourage creativity, maybe plan a virtual field trip with your children, and connect with other friends and family members over video chat, maybe during their recess lunch hour. And for full articles on homeschooling tips or virtual field trips, you can look at the links below. So next we're going to talk about COVID-19 resources for parents and providers. So some schools, as we mentioned, are offering 5 days of in-person schooling, while others are choosing to operate under remote learning options, and still some others are implementing a hybrid model. So working parents are understandably struggling with childcare concerns, but knowing your rights under the Families First Corona Response Act, or FFCRA, can help ease some working parents' concern. Under the FFCRA, certain eligible employees are entitled to emergency paid sick leave or expanded family medical leave if they are unable to work or telework due to caring for a child if 1. The child's school or place of care is closed. 2. The child care provider is unable due to COVID-19 reasons. If another suitable adult, such as a co-parent or guardian, is available, the employee does not need to take such leave. Next slide, please. If a child's school is open, but a parent chooses remote learning option based on a doctor's recommendation, they are more than likely not eligible for EFMLA. They may be eligible for EPSL if one can demonstrate that they are taking leave to care for a person who has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. If a child's school is open and a parent chooses to have a child homeschooled, the employee would not be entitled to FFCRA leave. An employee could qualify for FFCRA leave if a child's school is open, but the child's before or after school program is closed, such as their daycare. An employer should not be able to deny an employee FFCRA leave who had previously teleworked from home while the children's school was closed, but now intends to request leave if the child's school remains closed for the fall. An employee would most likely be eligible for FFCRA leave if the child's school is operating on a hybrid model because the school is effectively closed to that child on days when the child is required to participate via remote learning. Employees won't be able to use EFML if they have exhausted all of their FML leave allotted for the benefit year, which is usually 12 work weeks. This is very brief, and we recommend that you see the information below for the websites of the Department of Labor, labor.gov, and the New York State Department.gov paid family leave website. So here's a list of some national health resources, such as the National Suicide Prevention Lifeline or the National Child Abuse Hotline. Here are some more additional resources, national resources, such as the Veterans Crisis Lifeline, the elder care location, and the crisis residence of Pilgrim. And here is some resources from some local hotlines, such as the Adult Protective Services, Child Protective Services, or the Long Island Crisis Center. And now I'm going to pass it on to Philip.
All right, thank you so much, Christine, and thank you to everyone else who's presented this evening. Hope you guys have enjoyed this great information. Hopefully it was helpful for everyone. I do ask you just take another minute or two before we get to the questions that we have another webinar poll, just discussing the information that we went over this evening. All right, so I'm just going to release that poll to you guys now. You should see it on your screen. Give everyone a minute or two to get that completed if you can, and we'll proceed with questions.
Philip, will you let us know when everyone has completed?
Yes, absolutely. We'll give everyone just another 30 seconds. Just I see a few more responses coming in.
Rebecca, I did see that also for question 8, and we'll have to let Gabriella know that. Phil, did you see that? For question 8, the processed food option is not available. So we'll have to thank you, Rebecca.
Apologies. Thank you, Rebecca, for pointing that out.
Okay, so we have a few minutes left, and I'd like to turn it over to questions for Dr. Malazzo.
Thank you again.
Okay, thank you so much. And we had another question in the chat that was about someone concerned about a loved one with autism, a 4-year-old child with autism. And the challenge described is one where the child's having a difficult time keeping a mask on. And do we have any suggestions or tips to try for this concerned parent?
Yeah, Liz, that's another great question. So some of the things we can do, you might practice with different kinds of masks. You might find that a mask that's a little bit better fitting, a little snugger to the face, might actually be easier for your son to tolerate rather than something that's concerning around. The other thing is, it may be that, hopefully for him with school, there'll be some modifications available in the classroom if he really is having trouble wearing the mask, and maybe able to work with the teachers and the therapists at school. And then when you're out in the public, I know there was a slide earlier on that said that face shields are not a substitute for face masks, but certainly in a situation where somebody's really, really having trouble, and you're just out and about, like out shopping and so on, if you would wear a face shield, that at least gives you some sort of protection. And, depending on his level of sensitivity, that might be something that's a little bit easier for him to tolerate. And also, that could be like an astronaut mask or something else, rather, so you could be playful about that. So I think if you're speaking specifically to school, I would work closely with the teachers in the program and see how you could maybe fabric rather than the surgical masks might be more comfortable for him. And then, when you just out, a big shield, it can really full color and that might be helpful. Does that help, Loris?
Great. There's a comment in the chat from a parent who's sharing that their child, a daughter, it sounds like, has gross motor delays, and has been doing PT for about a year. Her daughter is 4 years old, or almost 4, and she's seeking some feedback on the exercise schedule that her daughter is undertaking. So, Dr. Malazzo, is this something you'd like to respond to?
Absolutely. And then if there's anybody else, Dr. Scott, if anybody else who might be able to speak to that, I'm certain I can, if you'd like.
Yeah, that would be great.
Okay.
Thank you.
Okay, absolutely. So this is another really great question and a very real question. Rebecca, I think that any kind of exercise is really valuable. So whatever you can do is going to be valuable. I think I would absolutely want to speak with the physical therapist that you have been working with to see if you can get any recommendations for things that you could try doing at home. I think kids really love to play with parents and other adults, so if you can really get down there and play with her, that would be helpful. So if she likes to dig, get down there and dig with her, and you might find that even just that act of moving dirt from place to place, whether you're beach, moving the sand from place to place would be helpful. Many times kids don't really like to do an activity because it's harder for them. So even more that you get out there and you play with her and make little baby steps, you're gonna able to get her to be make it easier for her to be moving and it makes it more fun for her to be moving. I think also it's important, she's almost 4 years old, so I mentioned earlier, attention span is limited at this age, so I wouldn't try to get down and have a half an hour long activity, but maybe do smaller blocks of time, 4 or 5 minutes at a time, and then maybe move on to another activity. And over time, with that repeated practice and repeated play, she may enjoy moving more and more. But any movement is great movement, and so don't we need to celebrate the little things, especially now. Times are tough, and as a parent, we feel so responsible for everything for our children. So be proud of the little changes and the little small steps you do. Look over the long term, just day to day. We'll try to get a vision on the long term. Sometimes doing simple things like taking a video of her over time and the play she's having, might see some improvement that you don't recognize when you're people day to day. And again, I absolutely consult with a physical therapist. And if she's in school or has any other therapists, also like what can they recommend for you to do with her?
Okay, I think Philip had some additional questions after this slide. Is that right, Philip?
Yes, we have a few questions here with a few responses already laid out for everyone. So some common questions we might have is, what happens if your child does test positive for COVID-19 or comes into close contact with someone who might have COVID-19? So students should immediately be placed on isolation at home for at least 10 days if your child does test positive or comes into close contact. So some questions are, what is a close contact? A close contact is within 6 feet of someone who's tested positive for COVID-19 for a prolonged period of time. So that's more than 10 minutes. Or someone who's tested positive for COVID-19 has coughed or sneezed or shared food with your child. We want to make sure that we identify those close contacts, and those close contacts should be remaining at home for 14 days of quarantine from the date of last exposure of the infected student. So the Suffolk County Department of Health and the individual school districts are following New York State Department of Health guidelines and the CDC guidelines on the appropriate decisions and pathways that will be taken if children do test positive or come into close contact with someone.
Great. Thank you, Philip. A couple of more questions we thought you might be interested in.
So as parents, do we have to report a positive or negative COVID test to the school district? Well, as per the Suffolk County Department of Health and Nassau County Department of Health, they have arranged a system with school districts to have, this, depending on who receives the positive or negative test first, the county will notify the school district, or the school district will notify the county Department of Health. But as parents, it's important that any information that you receive regarding your child's health, that you do share it with your school district. Each school district has a person who is representing the school district, such as the COVID representative, who you can report these positive and negative COVID test results to. So I know some parents are worried about their child's identity, being struck as, oh, my child was the positive child. So identity is being protected during these COVID tests. Each COVID test is specifically restricted to your child, and the results will remain nameless and de-identified. So the school and Suffolk County Department of Health only discuss the names of cases with specific persons, and they're following HIPAA and public health law. No other students or parents will be informed of names or identifying information. Well, you might think, well, how am I going to find out if my child came in close contact? The school districts are working diligently with the county departments of health to make sure that they keep an accurate list of where children are and where children are in the classroom, and specific seating charts so they can look back and determine who may have been in close contact. But for more information, I highly recommend that if you go to the SuffolkCountyNewYork.gov, Department of Health website, and they have a great amount of COVID-19 guidance and services available. Another question for those who have juniors and seniors in high school, is the SAT or the ACT, the college admissions tests, going to be waived this coming year? I know many colleges have waived it this past year for students who are applying to school. All test centers must adhere to local public health guidelines, so the test centers where the students go and take these testing exams. There is limited testing capacity in the areas due to public health restrictions and the high demand. So testing centers make individual decisions about whether to administer the SAT or the ACT. So we want to make sure that you find out more information from your individual college or university regarding their plan for requiring the SAT and ACT exam for the upcoming year. I know many schools have already begun making exemptions and specific requirements and changes to their admission statuses based on the current global and national and local situation with the coronavirus pandemic. But for more information, I highly recommend the College Board website, which administers the SAT and ACT exams.
Great. Thank you so much, Philip.